Mark your calendar, AAOS 2026 registration kicks off November 3rd. From March 2nd to March 6th, New Orleans is where orthopedics comes alive. Reunite with classmates, share ideas with peers, and connect with colleagues worldwide. This is where your best moments turn into memories. Don't miss out on early bird savings. Register now at aaos.org/NOLA2026. The AAOS Bone Beat Orthopedic Podcast channel is pleased to welcome you to the latest episode of the AAOS Now podcast. This monthly podcast series covers a broad range of topics to help orthopedic surgeons stay informed, enhance their practices, and provide the best possible care for their patients.
Hello, I'm Dr. Richard Schaefer, and I'll be your host for this episode of the AAOS Now podcast. My guest is Dr. Dean Taylor. He's a sports medicine orthopedic surgeon, professor of surgery at Duke. He's chair of the Feagin Leadership Program at Duke. He's a past president of the American Orthopedic Society of Sports Medicine. He's a retired Army colonel, number of other titles and accomplishments in his distinguished career. Dr. Taylor, Dean and I go way back. We were West Point classmates. We were surgery intern mates at Fitzsimmons Army Medical Center in Colorado, and our paths have crossed a number of times in our military orthopedic and civilian orthopedic careers. And it's great to have our paths cross again in this podcast. Dean, it's great to see you. Welcome.
Thanks for having me, Shafe. Strength is one. 81.
Strength is one, our West Point class motto. Yes, strength is one. We're going to be talking today about leadership development, its importance, and some guidelines on how to get involved in leadership training and how Dean is passionate about that. Dean, you're chair of the Feagin Leadership Program. Tell us about how that got started, your motivation for that, and tell us about that program.
Well, Shafe, the evolution of the Feagin Leadership Program really goes back to our days at West Point. West Point is recognized as a premier leadership, if not the premier leadership education institution in the world. And I think that the teaching of leadership skills at West Point has evolved, and my thinking about it has evolved too. When I came to Duke to join the faculty in 2006, I'd retired from the Army as a colonel. I'd had experience in leadership, and my role was really to take care of the teams. I was team physician for Duke basketball, and I was focused on what could I do in my role as a team physician, but also in my role as fellowship director for the Sports Medicine Fellowship at Duke. And that fellowship, I, at that time, had two fellows, and I felt like we needed to make it one of the top fellowships in the country. And I just read Jim Collins' book, Good to Great. And in that book, he describes the hedgehog principle, where great companies focused on what they can do better than anybody else and stuck to it with doggedness, hedgehoggedness, if you will. And I felt like we could introduce leadership education as part of our fellowship and intentionally do that. We could call on Coach K and other coaches' leadership skills, the Fuqua School of Business here at Duke, the Divinity School, the Sanford School of Public Policy. And my background, at that time, I felt like I knew a little bit about leadership from my experiences at West Point and as a career military officer. But that spark led to a lot of things, and it certainly led to an intentional change in the fellowship to where I would say we are one of the top orthopedic sports medicine fellowships in the country, as good as any. We continue to emphasize leadership education as part of that, along with all the other skills of surgical technique, clinical acumen, research, education, team coverage. But the game changer has been leadership development. And after I'd been at Duke for a couple of years, John Feagin, who was my mentor in many, many ways, I walked in his footsteps, and I were talking, and I said, John, what do you think if we named a leadership program in sports medicine for you. And he said, I'd be fully supportive of that. So we created the program to honor him and his legacy of leadership, and started in 2009. And all the scholars are selected after an application process to undergo a year-long immersion in leadership development. And it's medical students and residents and fellows, and they have executive coaching and sessions that teach them leadership skills. They have team projects. And then the second piece of it is the capstone event. And if you've been there at the Feagin Leadership Forum, which we have every May, and that brings together leaders from healthcare, from business, from academia, from the military, from athletics, to share ideas on certain topics of leadership, so that we all can learn from each other and be better leaders in whatever field we're in. So it's been a game changer, and those team projects that the scholars have been involved with have been game changers too. So in many ways, the Feagin Leadership Program is an incubator and catalyst for leadership education everywhere. And from that program have evolved an entire leadership curriculum for the Duke School of Medicine called the Leadership Education and Development Curriculum, the LEAD curriculum. Many of the alumni have started their leadership programs in their institutions where they've gone to. And now we are in the process of building a brand new nonprofit company called the Healthcare Leadership Foundation to scale medical education to intentionally teach leadership skills, interpersonal skills, those skills that help people learn to be more effective leaders across the country.
Dean, how do you and your program, how do you define healthcare leadership?
Well, the definition of healthcare leadership that we use is one that's very inclusive. And the definition that we use for leadership in healthcare is the ability to influence others for the benefit of patients and patient populations. And I'll say that again for the audience. Effective leadership in healthcare is the ability to influence others for the benefit of patients and patient populations. If you think about that, a medical student can influence things for the better, so they're a leader. If they have the skills to influence better, then they're an even better leader. And your custodian in the operating room, if they can influence things better, then your outcomes are going to be better. You're going to have fewer infections. They can influence things better. So everybody has a leadership role. If we can make their leadership skills better, then all of healthcare is going to be better. So it's everybody from the guy cleaning the operating room to the woman that's the CEO of the health system, and everybody in between.
That's great. And speaking of patient-centered, you really have the patient at the center of that definition, don't you?
We do. And that's a big piece of what we've done in some of our research, is to try to figure out what are the competencies, what are the skills that are most important for effective leadership in healthcare. When I started on this journey, there was a lot of models out there on leadership in business, hundreds, and good ones. And we used some of those at the beginning, but we found that they weren't specific enough for healthcare. So we looked and did the research and published on what frameworks or models were there for leadership in healthcare, and we didn't find any that helped us. There was one in the British healthcare system. It's a little too complicated and not really applicable for what we were trying to do. So we did the research to come up with what were the competencies for effective leadership in healthcare. But Schaefer, you talked about patient-centeredness. That's the core principle. That's the real differentiator of leadership in healthcare from leadership in other places. And that focus drives the best leaders.
Oh, that's great. What are some of the key skills that are important for healthcare leaders?
Yeah. So the competencies or the skills that we found were important to teach or emphasize were foundational competencies of service. You and I would say selfless service. In an age where there's a very concern about burnout, that is a turnoff, but there is this idea of service and caring for others, and integrity. Those are the foundational competencies. The framework for effective leadership is made up of teamwork and teaching teamwork skills and critical thinking. Not just having the knowledge, but having an awareness of what information was available, capturing that information, utilizing that information, and being aware of biases that may influence that information. And then at the top of the model, the keystone is emotional intelligence. And that's really where a lot of the teaching goes, teaching those skills of self-awareness, self-management, social awareness, and relationship management. And those skills can be taught and learned, and they're extremely important for leadership in healthcare.
Great. How about, I hear about importance of emotional intelligence. Is that a concept that you teach or emphasize, or is there a way you can learn that?
Absolutely. Emotional intelligence is the keystone, as I said. It's the framework. And I'll take a step back. Patient-centeredness is the core for effective leadership in healthcare. But you and I know that there are a lot of bad behaviors in healthcare that are justified by people saying, I'm just doing this because it's the best thing for the patient. Behaviors that break down relationships, break down the team, destroy the culture of an organization. Patient-centeredness is necessary, but it's not sufficient alone for effective leadership in healthcare. And integrity, service, teamwork, critical thinking, and most of all, emotional intelligence. And when I say emotional intelligence, 20 years ago when I was starting in this, I was aware of a term called emotional intelligence. I couldn't give you a definition. I can give you the definition now, and I can give you my 2x2 matrix of emotional intelligence for dummies. Would you like that?
Yeah, I need that.
I think we all need it.
Yeah.
The emotional intelligence, the definition that we use for emotional intelligence is the ability to recognize and understand thinking and emotions in yourself and others, and to use that awareness to effectively manage your behavior in your relationships. And so how does that evolve into certain skills? Well, of emotional intelligence, probably the foundation of building your emotional intelligence is having better self-awareness. And as I think about emotional intelligence skills, they're really in a 2x2 matrix. It's on one side, it's you and others. And on the other side, it's behaviors or management and awareness. And so self-awareness is really the beginning. And from there, once you're aware, then you go to self-management. And once you're aware of your own thinking and your own biases, your own emotions, then you can also have a better understanding of social awareness. And a piece of that social awareness is empathy. So your ability to understand what another person is feeling. And then once you have social awareness and you have self-awareness and self-management, then you go to relationship management. And that's the real challenge, but it's also where the real gold is in leadership, because you're really trying to influence others and build those relationships in order to accomplish great things.
I'm fascinated how some of what you're talking about in leadership development and importance in leadership are skills that can translate into the clinic, into working with the patient, being self-aware about when you go into that patient room, and self-aware and responding to the patient in an empathetic way.
Yeah. If we talk about using our definition of leadership, the ability to influence others for the benefit of patients or patient populations, at its most fundamental level, your ability to influence that patient is going to have a major impact on their outcome. So that's leadership at its most basic in healthcare. And the best leaders, the best clinicians, the best surgeons are the ones that have that self-awareness and self-management and the social awareness and build those relationships with their patients on an individual basis. Now, can we do that better on our own? Sure. we can also do it better if we are building a team that also has those skills. And so a big part of what we're teaching in leadership development is building the team and building the team's leadership skills. And I'll give you an example. I was in a busy clinic one day, and I'm getting ready to go into a room. I'm 5 patients behind like normal. And instead of pausing before the door like I normally do, I was getting ready to rush right in. And my nurse at the time, Kathy, she said, "Dr. Taylor, can I stop you for just a second?" And if I hadn't understood the importance of the team and creating a safe environment and a lot of these leadership principles that we'd been teaching, I would have said, "Catch me later." But I knew that this teammate wouldn't interrupt me unless she thought it was important. And I said, "Okay, Kathy, what's going on?" She said, "The patient you're about to see, Mrs. Jones, her mother just died. You'll see she's got her mother's picture pinned to her chest. When you go in there, I just want you to make sure that you're aware of that, because that's going to influence how you're going to interact with her." I said, "Thank you very much." Took a deep breath, and then I knocked on the door and I went in, and we spent 15 minutes talking about how great her mother was and how important she was. And at the end I said, "Look, this is the most important thing in your life right now. Let's work through this, and let's take care of your shoulder at another time." And she was one of my happiest patients.
Yeah, that's a beautiful story. That's wonderful. That's a great example. You mentioned that your motivation for improving leadership and developing leaders is to your motivation for having a great sports medicine fellowship. How do these principles translate into the teaching in your fellowship, into the operating room teaching, into the clinic teaching?
Well, I think every clinical situation has its possibilities to be a learning moment. You can't
Like you
be,
just mentioned, yeah.
yeah, you can't be teaching all the time, right? But when something occurs in your clinic or in your operating room that is a teaching moment, taking the time to emphasize, "Hey, did you see what happened with that patient? Maybe we didn't recognize that he had something else going on besides the pain in his knee. And could we have done that better?" And I learn as much from the fellows as the fellows learn from me, I think. And having those conversations and increasing the awareness. And certainly the Feagin program, all the sports medicine fellows are in the Feagin program as scholars, but the experiences that they have on the sidelines, in the clinic, in the operating room, those are all teachable moments. And I think that experiential learning and what they bring away from that experiential learning in combination with the new knowledge that we're giving them and giving them time to reflect on it. I mentioned that the Feagin scholars each have executive coaches, and those coaches help give them the opportunity to reflect on what they've learned so that those lessons learned can be lasting.
One of the things about the Feagin program that I find very interesting is that you mentioned that the sports medicine fellows are Feagin scholars, but the scholars, it's a multidisciplinary program. I've met pediatricians and anesthesiologists and medical students. And how does that work? How does that benefit the program? How does that benefit the healthcare leadership development?
It's a great question. And I will say at the start, we were more orthopedic and sports medicine focused. And then the second year of the program, we had a neurosurgeon applied, and a light bulb went off, and he said, "Wait a second, this is bigger than orthopedics." And since that time, we have had medical students and residents from all specialties. And we talk about diversity and the importance of that, of having diverse perspectives in your group. This is a great example of how the Feagin scholars are diverse in gender. We had equal men and women just about every year. Ethnicity from all different perspectives, from specialties and subspecialties across the spectrum of medicine. And we found once we expanded from sports medicine and orthopedics, getting those different perspectives from different specialties made all of us better. And I think it's just a great example of why diversity of perspective is so important to make your organization better. And we are certainly have embraced that, and it's certainly enhanced all the leadership programs that we've been a part of.
The Feagin Scholarship, it's named in honor of John Feagin, and I count myself in the group of those that were fortunate to know him and learn from him. Certainly a pioneering orthopedic surgeon and leader and great teacher. I still have in a letter that he sent me when I was a resident that was inspiring to me. Tell us about your relationship with him, and tell us more about John Feagin, the person and the orthopedic surgeon.
I'll just start by saying John Feagin, I'm getting goosebumps talking about him. He was the exemplar of physician leadership. His emotional intelligence was through the roof, and his caring was incredible with everybody he encountered. And if you talk to somebody that met John Feagin, probably the first thing they'll say is, when I first met him, he made me feel like I was the most important person in the world. He had that special gift to do that. So you and me and many others had the benefit of walking in John Feagin's footsteps. He was a 1955 graduate of West Point, was the first West Point graduate to go to medical school while on active duty. He was a field artillery officer at Fort Bragg and had a chance meeting with the dean of the Duke University School of Medicine, Wilbur Davidson, at a keg party. The dean was pouring beer for all the students, and John happened to be there, and he got into a conversation with Dean Davidson, and on the spot, he offered him an admission to the med school. So he had he had the knack of making a good first impression, even on medical school deans. And the hard part was getting the Army to agree to it, but he was able to do that. But John went on to served in Vietnam. He was a team physician at West Point under Coach Bob Knight. Mike Krzyzewski was a player when he was the team physician, and they've had a lifelong relationship and friendship. And John was also the hospital commander when we were cadets. Mm-hmm. And he was somebody that we all knew about. And I ended up going to medical school at Duke after I graduated, and I knew who John Feagin was. Everybody was asking me, "Oh, do you know John Feagin?" I'd never met him. And then I did the internship with you at Fitzsimmons Army Medical Center, now the admin building at the University of Colorado in Denver. And everyone would say, "Oh, John Feagin, yeah, John Feagin this, John Feagin that." I'd never met him. I don't know when you met him, but I still hadn't met him. And then I was a general medical officer at Fort Leavenworth. And my orthopedic mentor, a guy named Al Forbes, had done a fellowship with John Feagin. And he was always talking about John Feagin. I still hadn't met him. And then one day, Al Forbes came in and said, "Hey, we're going to go see John Feagin tomorrow. He's giving a talk down in Kansas City." So we went down to Kansas City, heard the talk. At the end, we're waiting in line to meet John Feagin. Al gives him a big hug, and then he says, "Dr. Feagin, I want to introduce Dean Taylor to you." And before I could say how much John Feagin meant to me and what an inspiration he'd been to me, he said, "The famous Dean Taylor, I finally get to meet him." And that's the guy he was. And we ended up becoming great friends. He came on the faculty at Duke when I was a resident. And then we had the fortune to name the leadership program in his honor. He died on September 1st of 2019. And part of our inspiration is to carry on that leadership legacy that he had through the Feagin Leadership Program.
And the Sports Medicine Fellowship at West Point is named in his honor. It was just featured in AAOS Now a couple of months ago.
Yeah, let's have a shameless plug for AAOS Now. The last issue was great. We had the discussion about care of military service members, and we had the highlight on the West Point Sports Medicine Fellowship named in honor of John Feagin.
Yeah, I thought it was a great issue with military theme. In addition to John Feagin, do you have any other leaders that are particularly inspiring to you, Dean?
Oh, I've been very fortunate to have a lot of great leaders in my life. And the common characteristic was that they really cared about other people.
Hmm.
Yes, you have to be technically good at what you do, and you have to have that proficiency. But what sets the great leaders apart, and John Feagin, the same thing, is you have to care about other people. And I'm concerned that our medical education, which the whole system was set up in the early 1900s, when there was a lot of time where you could demonstrate that caring. In this day and age, where there's so many time constraints and so many pressures on people, there's no intentional learning of how you care for other people, those people on your team, your patients, everybody in your work environment. That's the thing that we need to be teaching in our medical schools and our training programs, because that's what's going to differentiate the great leaders. And if we all are better at that and we all have that part emphasized, we're going to change medical care to get back to being a caring profession as opposed to a profession where we're counting beans.
Well, that's a great perspective and a great. It's inspirational for myself that has a role in teaching at the medical school. So I'm going to take that to my teaching practice. What would you, Dean, what would you advise? Say a resident's there, he's an orthopedic resident that may be not in your program necessarily, but what would you advise a resident that said, yeah, I want to become a better leader. What should I do?
Well, there's a lot of things that you can do. And I think what you just pointed out is probably the most important step is there's a lot of people in medicine right now who don't understand the importance of learning the skills that will help them to lead more effectively or their responsibility to lead in their profession. So the number one step is that appreciation that you have that responsibility. And if someone asks me that question, what can I do to become a better leader? Then that's a huge step towards becoming a better leader. That desire to want to be a leader. If somebody doesn't want to learn to be a more effective leader, you can't teach leadership. You can teach skills that will help people learn to be more effective leaders if they want to, but you can't force it on anybody. So I think that's a big piece. And then once they've got that desire to learn those skills, then emphasizing those emotional intelligence skills, especially self-awareness, self-management, social awareness, relationship management, build those teamwork skills, and how to build an effective team, how to work in a team, how to be a good teammate when you're a leader, when you're a follower, all those important things. And they tie together. All these things tie together, those competencies that I mentioned in the leadership model, because once you develop those competencies, then you can communicate better. You can understand better. You can bring together people from different perspectives. And that's going to make you a more effective leader. And, if people go to the Feagin Leadership website, there's a number of resources from books and articles and videos and there's tons of things that are out there that you can use to learn to be a more effective leader that'll bring you that new knowledge. But the main thing is just put yourself out there in situations where you have to try to influence things for the better. And you're gonna fail at it because this stuff is hard. But if you are doing it with the right intention, with the right mindset, with the patient-centeredness, you're going to learn from those mistakes and get better. And then think about it.
That's fantastic. And John Feagin has a saying that's similar to what you just mentioned. What you said at the leadership forum. Could you share that with us? The Feagin expression.
Yeah, our definition, the ability to influence others for the benefit of patients and patient populations. That's the definition we use for healthcare leadership. John Feagin's own personal mantra, because he had the self-awareness of what worked for him, was for him, his leadership mantra was do the right thing at the right time for the right reasons. And if you think about it, if that's your mantra and you're living true to that mantra, you're going to be a pretty damn good leader, no matter where you are.
Do the right thing at the right time for the right reasons.
Yeah.
Yeah. I actually have that on a little card in my office to remind me of that at times. So that's great. Is there anything you'd like to add, Dean? Anything to add pearls of wisdom for us?
You know, as I've been doing this now for 20 years, I've made a lot of mistakes. And I look back on when I was an orthopedic surgeon at West Point, and some of my behavior, I look back on and I say, that was just horrible. I can think back to a time where I had a scrub tech. There was a trainee in my operating room, and he kept contaminating the field. And I'm doing an ACL on a cadet, and I just lost it. I threw him out of the operating room. I was yelling at him. I said, don't come back here until you know what to do. And I never saw the guy again. No. I was doing it because I was focused on doing what was right for the patient. But what that did, it broke down the culture of a safe culture in our operating room. It broke down the team dynamics. And I'm not sure what it did to that young person's career, but I certainly didn't help it. And I'm ashamed to even share this story now, but I think it's important to share it. And I think a lot of people know, we published on this in JBJS. In 2015, I had my ulnar nerve cut in my operating room by a scalpel that was placed on a Mayo stand where it didn't belong. And I look back on my reaction in 2015 compared to 15 years before at West Point, and it was completely different. Instead of blaming someone, thinking about the future, because I'd been involved in leadership education and focused on selfless service and self-awareness, self-management, as soon as I knew what had happened, I brought our team together to focus on the patient and to take care of each other. And that to me is the example in my mind of what everyone can do if they're focused on becoming more effective leaders. I look back on it and I say, transformative. And what I'm trying to do is now teach others so they don't have to go through the same mistakes that I made when I was younger. And if we do that in medical schools, if we do that in residency, if we do that in continuing medical education, if we do that in our professional societies, the AAOS Assembly started the BOLD program, the Building Orthopedic Leaders Development Program, about 3 years ago. And it's been phenomenal. And we took the principles from the Feagin Leadership Program and we brought it to professional society. That's what the Healthcare Leadership Foundation is going to do at all levels to really support and enhance programs that are already out there, but also create programs for people that want to create it. And that's my next chapter and what I'm really excited about now. So if I could share with the listeners two connections. Feagin Leadership Program, and if you go to the website, www.feaginleadership.org, lots of resources, lots of material, and there's information about our annual leadership forum there, and registration's going to open in February for that for people that want to come. It's April 30th and May 1st of this year, a little bit earlier this year, and our theme this year is Leading with Humanity in the Age of Artificial Intelligence.
Wow.
So a very timely theme.
Yeah.
And we've got an amazing lineup of people that are doing that and have learned the good, the bad, and the ugly of leading in using AI and failing when they've tried to use AI. So we're going to learn from all of them. Then the other piece, the Healthcare Leadership Foundation, HLF, to me, that's the next step. That's what's going to change healthcare in this country. www.healthcareleadershipfoundation.org, nonprofit company. We're 6 months into it, and it's just keeps growing, and we're looking forward to partner with anybody that wants to see more effective leadership and teach leadership skills across all of healthcare.
Well, Dean, thank you very much. It's great to share this podcast with you, and look forward to some great leadership education from you and your team in the future.
Thanks, Jay. Really enjoyed it, and look forward to our next adventure together.
Sounds great.
Thank you for listening to this episode of the AAOS Now podcast, part of the AAOS Bone Beat Orthopedic podcast channel. Production and editing provided by MK Quinn Media. Don't miss out on future episodes of the AAOS Now podcast. Bookmark our page, aaos.org/AAOS-now-podcast. Listen to new and past episodes on Apple Podcasts, Spotify, and the Health Podcast Network, and watch video versions of every episode on the AAOS Now podcast YouTube channel.